Fellow Sarawakians, I'm Kelvin Yee. Just imagine, Sarawak has all the advantage in terms of controlling and curbing the spread of COVID-19 in Sarawak, especially when we have immigration autonomy and we can control people coming in and outside of Sarawak. But even with that, we had one of the highest infection rate in the whole country and also one of the highest death related to COVID-19 per 1 million population in the whole of Malaysia. On top of that, we have a high vaccination rate in Sarawak because the federal government gave us stock of vaccines early due to the upcoming Sarawak elections. Even with all these advantages, we see worrying statistics of COVID-19 cases, COVID-19 deaths, lack of test rates in Sarawak. That is why this proves that the Sarawak Disaster Management Committee or SDMC has failed and has shown their incompetence in terms of managing and curbing the spread of COVID-19 in Sarawak. I can give you 4 main examples. Number 1, even with the high number of positive cases in Sarawak, fact of the matter is we have been under-testing for a very long time. The positive rate in Sarawak at one time is up to 25%. It is 5 times more than the recommended rate by the WHO. One of the reasons is the policy by the Sarawak government not to test asymptomatic close contacts. We know that even asymptomatic patients carry the virus and can spread to other people. So again, we test less, the numbers are low, we are pretending as if everything is okay when it is not. Number 2, SDMC since the beginning has been coming out with SOPs that are confusing, changing, U-turn, last-minute announcements that is not just has caused so much inconvenience to the public, to business owners, but a lot of them are not based on good science. For example, the SOP for quarantine when arriving in Sarawak was not followed, and because of this, sparked one of the biggest clusters known as the Pasai cluster, which caused the third wave in the whole of Sarawak, especially in the rural areas. Number 3, SDMC and the government failed to strengthen all necessary public health capacity, including fast testing and fast isolation. During the peak of infection in Sarawak, many had to wait days just for an ambulance to come to their house to pick them up. Many have to wait long hours just to be tested. And because of that, it may have caused unnecessary deaths that could be avoided. And lastly, number 4, SDMC's role is to advise the state government to protect the health and security of the people in Sarawak. But they failed to advise the state government not to have an election so early.
No! God, please, no!
Even when the pandemic is still raging in Sarawak. At that point, when election was called, the ICU numbers in Sarawak was so high. Fact of the matter is, we had the advantage to observe and monitor the effects of the Melaka election first. Only then we make a decision to have ours. But yet, they still chose to have an election at the expense of the health and safety of the people of Sarawak. So we clearly see how political considerations has trumped health concerns of our people. So fellow Sarawakians, this and many more other examples has shown how SDMC has failed us, and their incompetence have caused so much inconvenience, caused so much pain, and even worse, unnecessary deaths that could have been avoided. This is on top of the neglected healthcare system in Sarawak for the past 58 years under BN Sarawak, or now known as GPS. And that is why they must be made accountable and take responsibility for their incompetence. So let us all come out to vote, send a strong message, and let our voices be heard.